Hello. For more than 20 years, I've been working with and carrying out research with people who've been harmed by drugs, people who've been harmed by their use of drugs, but also people who've been harmed by our attempts to control their use of drugs. And unfortunately, those harms have been rising over that time. For the most recent year that we have records for in the UK, 2015, more than 3,000 people died, deaths that were related to drug misuse, which is the highest figure on record. Now, I'm sure that many of the people in this room and watching online will have thought there must be a better way to do this, and legalisation will have crossed their minds as a potential alternative. But what I'm here today to talk about is some of the wrong ways in which we could do legalisation, and at least one good way in which we could do it, which I'm going to call progressive legalisation. So let's start from the harms that we're currently creating with the current approach of prohibition. We have the harms of criminalisation. In the UK, we're giving more than 50,000 people a year a criminal record for simple drug possession. And the UK is by no means the world's most ardent enforcer of the war on drugs. That dishonourable title currently belongs to President Duterte of the Philippines, a leader who's currently engaged in killing thousands of his own people in the name of drug control. We also see the donation of a hugely profitable market to organised crime and criminals who are incentivised to use excessive levels of violence to control the production and distribution of these substances. And these substances are often produced and distributed in forms that are highly unsafe and used in circumstances that are unsafe and unhygienic. Just here in Canterbury, we've had a spate of deaths in just one public toilet. And we also see deep inequalities in the distribution of these harms, harms associated with use and the harms associated with the control of these substances. So, for example, in England and Wales, if you're black, you're 6 times more likely to be arrested for a drug offence than if you're white, and you're 11 times more likely to be imprisoned for a drug offence if you're black than if you're white, despite there being no solid evidence that black people have higher levels of drug use or drug offending than white people do. So this is the baseline from which we're looking for alternatives. And we're in an exciting period in the history of drug policy, as many alternatives are being developed and tried out in different countries. In Portugal, we have the example of decriminalisation, not just of cannabis, but of the decriminalisation of the possession of all illicit drugs, which was enacted in Portugal in 2001, alongside significant investment in public health initiatives that have seen dramatic reductions in drug-related deaths and HIV infections related to injecting drug use. We also see some quite interesting bottom-up examples of legalisation. So in countries where possession has been decriminalised and people have been allowed to grow small quantities of cannabis plants, some people have pooled their resources, collected their allowance of plants together in cannabis social clubs, and also shared out that harvest. And this is going on in Spain and in Belgium and in other countries. There are also more state-controlled models of legalisation, such as we're now seeing in Uruguay, where it's possible to get a licence to grow cannabis. It's also possible to get a licence to sell cannabis, but if you want to use cannabis, you need to put yourself on a national register of users. This is quite a statist approach. And as you can imagine, those states in the United States of America, which have legalised cannabis, have done so in a much more free market-oriented way and a much more relatively commercialised way, with people being able to sell cannabis and use cannabis with less restrictions. And I'm rather worried about this model of creating a free market in cannabis and other substances, because there are a lot of unintended consequences that could occur. One of them is that a pretty predictable effect of legalising the production and sale of currently illicit substances is that we'll see massive reductions in prices. A lot of the price that people currently pay for these substances is the compensation to the dealers and the traffickers for the risks that they're taking, and the increased costs that are placed upon the growers from an illicit activity. And it's been estimated by John Colkins, a researcher in the United States, that if there were to be a legal market in the production of cannabis, the price of production, the wholesale price, would fall from currently above $3,500 per pound of cannabis to less than $500 per pound, and even less if cannabis production moved out into lightly regulated open-air farms. And if we reduce the production price in a competitive market, we're also likely to see massive reductions in the retail price. And we know from other temptation goods, as John Colkins calls them, like alcohol and tobacco, that if you reduce the price, the use increases. Now, use increasing on its own may not be a problem. After all, many people would get pleasure from that. That is the reason why people use these substances, because they find pleasure in them. But we also know that when the consumption of these temptation goods goes up, in general, the harmful aspects of that use go up as well. And that's been proved again and again in the case of alcohol, that when consumption increases in a society, we also see increases in the levels of health harms associated with that use. There's also the danger that we could inadvertently increase use of these substances by children. Now, there's a lot of controversy about the relative harms of the use of cannabis, but it seems that if there are harms of using cannabis, that they are most likely to occur amongst those who start early, before the age of 18. So we no more want people to be using cannabis at a young and sensitive age than we would want them to be using nicotine, tobacco, and alcohol. And there's also the danger of creating a large industry which would have an incentive to grow and expand the market from whatever source, and also would be given the financial power by which to protect that market. So there are a number of ways in which a legalized drug industry would seek to expand its market. It would do so by advertising and branding. It would do so by price promotions. So we currently see that with alcohol in our supermarkets, where the companies deliberately cut the prices in order to encourage people to buy in bulk. We would see companies using sponsorship opportunities, so sponsoring cultural and sporting events to encourage people to use their brand. And we'd also see product innovation. Now, we're already seeing that in states like Colorado and Washington in America, which have allowed the sale of recreational cannabis. We're seeing people moving away from just the herbal or resin product into waxes, oils, tinctures, vaporizers, edible products, and even infusing cannabis into sweet drinks. Now, some of these innovations might be less harmful. It is probably less harmful, for example, to use cannabis by vaporizing than it is to use it by smoking the raw product. But others are more harmful. We don't want there to be the promotion of cannabis use to children through placing it in sweet drinks in packaging with lots of sugar that's attractive to them. We'd also see this increase, predictably increasing the levels of harms, and it would create a market which had huge amounts of cash and political power to prevent people from reeling it back. And again, we can look at the example of the alcohol industry, which has used lobbying and the financial power it has, both through donations directly to political parties and also the power to employ lobbyists to influence political decisions. We see them using lawsuits to prevent controls on how they sell and what they sell and at what price. So, for example, the alcohol industry has for years delayed the imposition of a minimum unit price for alcohol in Scotland by a number of lawsuits against the Scottish government. We also see a phenomenon of regulatory capture, where representatives of the industry are invited in to help the government decide how their own industry should be regulated, obviously leading to influences towards an expanded and protected market. And we also see the possibility that the government might be less willing to control the market if it is sharing the revenue of that market. So, for example, with the tobacco industry, a lot of the difference between the price of production and the price that smokers are paying in the shops is money that's going directly to the government, therefore giving the government less of an incentive to reduce smoking and its harms overall. And another danger we see with a commercial market is that the harms of these commercial markets are again focused on the poor. There's lots of research suggesting that the density of alcohol outlets and the most damaging types of alcohol outlets are placed in poor communities, and certainly with the gambling industry, we see a very strong concentration of gambling outlets and the harms that are associated with them in our poorest communities. So what I'm saying is that there are ways of doing legalisation that would predictably increase harms. And I want to suggest to you an alternative that would have a better chance of reducing harms, and I call that progressive legalisation. It's progressive for two reasons. The first is that we start small, and if that succeeds, we expand the focus of legalisation. The second reason is that we do it alongside attempts and efforts to reduce inequalities and health and inequalities in the distribution of criminal justice harms. So when I say starting small, let's take the example of cannabis. Well, we want to decriminalise that, the possession of that, alongside probably the possession of all drugs, because there's no evidence that criminalising possession actually reduces the harms related to drugs. So that's a starting point. Then we could think about allowing people to grow their own cannabis, perhaps a few small plants. We could think about allowing people to pool their allowance of cannabis plants in social clubs to which only they would have access. We could think about moving that into shops and retail outlets, but licensing those and placing it under strict conditions, including controls of the price, controls of the product type, controls of the product content to regulate levels of THC and CBD within the products that are sold. We could certainly put in this country a ban on advertising and branding. If we're going to be selling cigarettes in plain package, there's no reason why we shouldn't also be selling marijuana or cannabis in plain packaging and not allowing people to promote on the packaging. And we might also want to think about hypothecating the tax revenues. So instead of sharing all the revenue with the government for general taxation, we could think about making sure that any tax revenue that's raised goes towards reducing the related harms. So placed in evidence-based prevention programs, spent on treating the problems and reducing the harms that are related to drug use and cannabis use. And the second element of this progressive legalisation is to reduce the health inequalities that are so deep in our society. Since 2010, infant mortality in this country has been increasing in the poorest social groups. In 2015, that increase was so large that it drove an overall increase in infant mortality in the United Kingdom. And similarly with drugs and related harms, we see massive inequalities. So for example, the rate of drug-related deaths is 5 times higher in the most deprived communities than it is in the least deprived. So any moves we make on the legal front with drugs should be accompanied by society-wide efforts to reduce inequalities in health. And this would involve defending and extending universal health care and defending and extending direct fiscal transfers from the wealthiest to the poorest in our society. So next time you're confronted with a story about drug-related death or a drug-related arrest, I would like you to consider alternative ways that we could adopt. And I'd like you to think about how we could do this without creating an industry that has an incentive to increase social levels of harms, and how we could do this alongside efforts to reduce inequalities in health. So I invite you to consider progressive legalisation. Thank you.